If you take a pill for your blood pressure every single day, I need you to watch this. Not because I want to frighten you, not because you should stop taking it, but because there is something happening inside your legs, slowly, quietly, one night at a time, that your doctor may never have mentioned, and that most people don't discover until the symptoms have already become impossible to dismiss. I want to tell you about a patient I'll call Carol. She was 71 years old. She had been on a diuretic, a water pill, for almost 3 years, prescribed to help manage her blood pressure and some fluid buildup her cardiologist had spotted. Her numbers looked good. She was doing everything her doctors told her. And then slowly, over about 18 months, she started noticing something in her feet at night. A faint tingling, a burning sensation. Pins and needles, especially after she had been lying still for a few hours. Some nights it kept her awake. She mentioned it to her doctor. She was told it was probably normal nerve changes from getting older. It wasn't. What was happening to Carol had nothing to do with aging. It had everything to do with what her water pill was quietly pulling out of her body day after day, year after year, and what that slow, invisible depletion was doing to the nerves in her legs. Stay with me, because I'm going to show you exactly what that connection is, why nighttime is when it shows up first, and what you need to bring to your doctor at your very next appointment. The right question, just one, could change how your legs feel within weeks. Before we go further, I want to ask you something, because your answer will tell you which part of this video matters most for you. The sensation in your legs at night, is it swelling? Heaviness? Your ankles or feet looking visibly puffy by evening? Or is it something you feel from inside? Tingling, numbness, a burning sensation in your feet or lower legs, especially when you are finally still? Both experiences can come from blood pressure medications, but from different medications through completely different mechanisms. There are two separate pathways here, one visible, one invisible. I want to take them one at a time, because knowing which one fits your situation is what turns this video into something you can actually use. Let me start with the more visible one. The one affecting millions of people right now, most of whom have no idea what is causing it. There is a class of blood pressure medications called calcium channel blockers. The most commonly prescribed include Amlodipine, sold as Norvasc, as well as nifedipine and felodipine. These are among the most widely used blood pressure medications in the world, and they have a side effect in the legs that most patients are never clearly told about. These medications work by relaxing the walls of your blood vessels so blood flows more easily and your pressure drops. That part works exactly as intended. But here is what happens specifically in your legs. When a calcium channel blocker relaxes the arteries in your lower limbs, the vessels that bring blood in, it does not have the same relaxing effect on the veins that carry blood back out. More blood flows in than drains away. The tiny capillaries inside your leg tissue end up under more pressure than they can handle, and fluid leaks out of those capillaries into the surrounding tissue. That fluid pools in your feet and ankles. That is the swelling. Now, for many people, that swelling feels uncomfortable, but not medically alarming. A nuisance. Something they have learned to live with. But here is what most people, And honestly, many doctors do not connect. Chronic fluid accumulation inside your leg creates pressure. Running through your feet, your ankles, and your lower legs is a dense network of peripheral nerves. The nerves that give you sensation in your feet, the ones that tell you when your toes are warm or numb or being touched. When fluid accumulates around those nerves persistently, night after night, month after month, it compresses them. And compressed nerves begin to malfunction. They send confused signals, tingling, burning, numbness, a sensation that your feet don't quite belong to you. Research published in clinical hypertension literature confirms that amlodipine causes peripheral edema in more than 1 in 10 patients on a standard dose. In women over 60, the rate is significantly higher. This is not a rare side effect. It is one of the most common side effects of one of the most widely prescribed medications on earth. And the nerve symptoms that can follow are almost never traced back to the pill. But here is what I need you to understand. Everything I just described, the swelling, the fluid, the nerve compression, is the mechanism that doctors have at least heard of. It is visible, it is measurable. It can be seen on an examination. The second mechanism, the one Carol was living through, does not show up anywhere unless someone specifically looks for it. There is no visible swelling. There is no obvious warning sign. It builds in silence, one day at a time, since the first morning you swallowed your water pill. And for many people watching right now, it has already been happening for longer than they know. When you take a diuretic, a water pill, your kidneys work harder to flush excess fluid from your body. That is the intended effect. Your blood pressure comes down, the fluid burden on your heart reduces, and for many people, it is genuinely the right medication. But diuretics also flush out something else, something most people have never heard of, and something your leg nerves cannot function without. Thiamine, vitamin B1. Thiamine is not a wellness supplement. It is the vitamin your nerve cells use to produce energy, specifically to maintain the myelin sheath. The myelin sheath is the protective insulation wrapped around every peripheral nerve fiber in your body. Think of it as the plastic coating around an electrical wire. When the coating is intact, the signal travels cleanly and quickly. When it thins or breaks down, the signal becomes distorted, slow, and misdirected. Thiamine is what your nerves use to maintain that coating. And diuretics, especially loop diuretics like furosemide, sold as Lasix, flush thiamine out of your body as part of their normal function. A study published in PubMed, conducted specifically in elderly hospital patients, found that diuretic use was the single strongest predictor of worsening thiamine status during the hospital stay. The researchers identified a direct relationship between cumulative furosemide dose and B1 depletion. A separate published review identified chronic diuretic use as a recognized risk factor for subclinical thiamine deficiency in older adults. Subclinical means the deficiency is real and measurable, but hasn't yet reached the level that produces dramatic, unmistakable symptoms. It sits quietly in the background, slowly accumulating. And its early signs, tingling in the feet, a burning sensation in the legs, mild weakness, appear first at night when you are finally still enough to notice them. That was Carol, 3 years on a loop diuretic. Slowly, progressively depleted of the very vitamin her leg nerves needed to maintain their insulation. Told every time she mentioned it that it was just aging. When her doctor, with her cardiologist's involvement, checked her thiamine level and addressed what was found, her symptoms began to improve. I need to be very direct about this. Do not stop taking your blood pressure medication. Do not adjust your dose. Do not begin any supplementation without speaking to the doctor who prescribed it. What I am giving you today is not a treatment plan. It is the information to have a better conversation. Now, there is something that most people on blood pressure medication have never been told. Not by their GP, not by their cardiologist, not even by their pharmacist. It is why this problem hides so effectively for so long. It is why it gets dismissed as aging so easily. And once you understand it, you will know exactly why your symptoms only appear at night and why that has nothing to do with the time of day. During the day, you are upright and moving. Gravity and muscle contractions help push fluid through your legs and back toward your heart. Your feet are receiving constant sensory input. The pressure of the floor beneath you, the warmth of shoes, the continuous feedback of movement. That constant input matters more than most people realize. A nerve that is firing slightly incorrectly gets drowned out by the flood of correct signals arriving from everything else. The disruption is there, but it is masked hour after hour. But when you lie down at night, everything changes. You stop moving. Gravity no longer helps drain fluid from your lower legs. The sensory input from your feet disappears completely. And the nerves that have been quietly struggling, whether from fluid compression or from B1 depletion, suddenly have no competition. Every confused signal they send is the only signal your brain is receiving. That is why Carol's feet burned at 11 p.m. and not at 11 a.m. That is why your legs feel heavy and uncomfortable the moment you finally get still. That is why it has been so easy to dismiss as aging, because it appears to be a nighttime problem. But it has been building inside your legs all day, every day, for months or years. Which means the 3 things I am about to give you are not optional. Not if this has been going on for more than a few months. Not if you have been told more than once that what you are feeling is simply how things are now. For some of you watching this, the depletion has been building since the day you filled your first prescription. And it is reversible, but only if someone asks the right question. Here is what I want you to bring to your next doctor's appointment. The first, know the class of your blood pressure medication, not just the name, the class. If the words amlodipine, nifedipine, or felodipine appear on your label, you are taking a calcium channel blocker, and leg swelling with possible nerve compression is a known documented side effect worth discussing. If your label says hydrochlorothiazide, furosemide, torsemide, or chlorthalidone, you are taking a diuretic. Thiamine depletion with long-term use is a documented and testable risk. Write it down, both the name and the class, bring it. The second, document your leg symptoms for 1 week before your appointment. What time they start, whether you feel swelling, tingling, burning, or numbness. Which leg, which part of the foot, whether moving temporarily helps. This is not self-diagnosis. It is the clinical data your doctor needs to connect what you are experiencing to what you are taking. The third, and this one is critical if you take a diuretic, ask your doctor to check your thiamine level specifically.
Not a general vitamin panel.
Thiamine, vitamin B1. If you have been on a loop diuretic for more than a year and you have noticed any change in sensation in your feet or legs, this is a clinically reasonable and appropriate question to ask. It is a simple, inexpensive blood test, and it is one that most doctors do not think to order unless someone asks. That one question may open a conversation that has been waiting to happen for years. Let me bring this together. Blood pressure medications, for most people, are genuinely important. They protect your heart, your kidneys, your brain. I am not asking you to question whether you need yours. I'm asking you to make sure that the medication protecting one part of your body isn't quietly affecting another, and that you have what you need to ask the right question before more time passes. Two things to remember. If you take a calcium channel blocker and your legs swell by evening, and you have developed tingling or numbness in your feet, those two things may not be separate problems. Ask your doctor about switching to an ACE inhibitor or an ARB, which achieve the same blood pressure control without the same mechanism in the legs. Many people see a real reduction in swelling within weeks of making that change. If you take a diuretic and you have developed tingling, burning, or numbness in your feet or legs over time, especially after a year or more on the medication, ask your doctor to test your thiamine level. Test is inexpensive. The answer could explain everything. Carol spent 18 months being told that the burning in her feet was aging. 18 months of broken sleep and unanswered questions. It wasn't aging. It was a vitamin her pill had been flushing away silently, one day at a time. The moment someone asked the right question, everything changed. You deserve that same conversation. You deserve someone who will actually look. And now you have exactly the words to ask for it. Drop a comment right now and tell me, do you take a blood pressure medication? Have you ever connected it to something you feel in your legs at night? I read every single response, and your answers shape what I make next. And if someone you love takes a blood pressure pill every day and has been struggling with leg symptoms they cannot explain, please share this with them. They need to hear this before you go. In our last video, we looked at what happens to your leg nerves at night. The misfiring signals, 3 a.m. cramps, the nerve that no doctor thinks to check. Today we went deeper into what certain medications may be quietly doing to those same nerves over months and years. But here is what neither video has fully explained yet. Your legs have their own drainage system, a separate network that runs alongside your blood vessels, whose entire job is to clear fluid, pressure, and debris from your tissues, and to protect the nerves inside your legs from exactly the kind of chronic compression we talked about today. And this system begins to slow down significantly after the age of 60. Not because of any disease, not because of anything you have done wrong, simply because of how it ages. When it slows, the fluid that should be draining isn't. The pressure that should be clearing doesn't. By evening, your legs feel heavy, swollen, and exhausted, even when you haven't done very much at all. Next week, I am going to show you what this system is, exactly why it fails after 60, what you can do to restart it at home in under 10 minutes, with no equipment and no medication. subscribe. Because if your legs have been heavy and swollen for years and no one has ever given you a satisfying explanation, next week's video may finally be the one that makes it all make sense.